Okay, let's start off. So today's webinar is all about the crucial role that sample integrity plays. Um, and we have to understand that every report that comes onto um, the paper, the value that is on the paper should be the value which is there in the patient's body. So, our utmost importance is to be given to sample integrity. Now, if the sample integrity is lost, the value is totally wrong. It is not the value in the patient's body. And once it is deteriorated, like it's like I keep referring to cooking. If the dish is spoiled, would we be able to eat it? It has, the purpose is lost. So having a sample which is very, 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 very on par, the ingredients, the constituents in the sample should be on par exactly how it is in the body. When that happens, then the value on that report will be exactly how it was at that point of time when the sample is taken. So that is what everybody, all of us should understand, that we've all been concentrating on equipment, QC, calibration, but we've realized that a percentage of errors happen at that point. The major percentage, 65% of the errors happen here. And none of us are actually concentrating on this area. We might say, okay, once a sample comes to us, we are doing a good job. No, our responsibility is right from the time the doctor thinks about ordering the test, because we should educate them onto what are the latest tests that are there, what is the sensitivity, what is the specificity, when do you collect the sample, what is the time of collection, what is the patient preparation, how the sample has to be collected, which container it has to be collected. It is our duty, it is our role to tell them how it has to be collected. And that is the crucial role that we need to play. If we say, okay, we put a sample, the value came in, it's garbage in, garbage out. No, we all have to now concentrate on the pre-analytical phase, which is 65% of the times the report is wrong. And all of us, we think it's not our area. It is our area. And that is why in 15189 2022, POCT is also come in. And I wish it becomes that every doctor undergoes training in how to order tests, when to order tests, what instructions to give the patients. Because patient preparation is very important, sample collection is very important, be it for anything, be it for microbiology, pathology, biochemistry, anywhere. When we collect, how we collect is very, very important. Now, first of all, hi everyone. Thank you for taking the time to join me today. And I wanted to have this conversation with all of you about something that is incredibly important to our work and more importantly to the patients who depend on us. I wanted to put up this slide because we all became doctors to treat patients. And somewhere along the line, we are not dealing with patients directly, but indirectly, and that connection is gone. What it actually, when you go to a patient, when you talk to a patient, when you see the patient, when you feel he's sick. So it's very, very important that we understand what it is all about. So it's very, very important that we understand that on the other side, the sample that we have is of a patient. So we know that 65% errors happen, and that is a challenge. We have to acknowledge that challenge. We have to take it upon ourselves. If we want correct reports, if we really want to help patients, we have to understand all the challenges and we have to acknowledge them and we have to address them. I know sometimes because nobody is holding us accountable for the small details, it might seem easy to cut corners or just do a bare minimum to get by. But I want to take a moment to explain why that mindset can be dangerous, not just to our work, but to the people who rely on us. All the patients who are there, they trust us, they're paying us. And because they are paying us, we are able to get our salaries. And because of our salaries, we are able to run our houses and put our children into. So we owe it to them that we do a good job. Like, see, if a maid comes to our house and you pay her and she does only half the work or she does it wrong, don't we all feel very miserable about it? At least here it's not harming, but with patients, our wrong value is harming the patient. So it's time that we all get in and understand that it's time to connect to the bigger picture. We need to connect to the bigger picture as each of us play a crucial role in ensuring that not just every test result of every sample and every procedure we do it with utmost accuracy and care. And these are not just another task on a checklist. These are actually steps in a process that directly affect the health and well-being of real people, people who trust us to do it right. So that is the reason why I keep telling that it is very, very important that we do our work properly. Now, coming to the consequences, we all know that if we don't do this properly, there are consequences. And what are the consequences? I want to share a little story with you about a hospital acquired infection. A small mistake that could have been avoided if someone had just taken a little more time to double check their work. And that one moment of carelessness had a ripple effect and led to serious consequences. And it didn't happen to anybody else. It happened in my own family. It happened to my three members of my family: my father, my mother in law, and my cousin. My father went in for a CABG and he landed up with hospital acquired infections. My mother in law went for a simple laminectomy and she was a practicing gynecologist. And what happened was she had lateral popliteal nerve paralysis because of septic arthritis. She had infection. And another cousin of mine who had an implant put and it got infected and he had to get his leg and amputated. Now, my mother in law stopped her gynecology practice and she's been on a walker since 35 years. My father still suffers with the massive amount of keloids that he has. Our businesses went down crashing because we'd given power of attorney to somebody. So we have to understand that one small, it can happen. It's if three instances happen in my life, imagine all over the world how many people are getting affected. So every patient, every situation, every sample is very, very, very important. A point one difference if a person is having a heart attack or not heart attack. If we give it as troponin normal and he dies, that family is never going to have a mother, brother, sister. Or so that is the important which. So we need to take responsibility. We have, if we really want to call ourselves doctors, we need to take responsibility. And remember, you have the power to prevent such outcomes. We have a lot of power. And that comes by we taking ownership of our tasks, by striving to get things right the first time. Remember, we are not just doing a job, we are saving lives. And that's something to be very, 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 very proud of. Every report we are saving lives. I remember my staff, Sharmila, I said, aren't you tired after doing? No, ma'am. When I go back to sleep, I know the number of people I have helped get better. So I really feel very nice. So take ownership of the task that we are doing. And yes, resistance. There's a lot of resistance. Why? And that is the reason we don't go the extra mile, because we feel overwhelmed. We feel, oh, this is too much. Why bother? We don't know because we are not trained. It is not part of our curriculum, or we're just not motivated enough because we don't come in contact with the patients. If that's the case, I want to hear from you. Don't we all, we are a team, and my responsibility is to ensure to support all of y'all in your training with all the resources for y'all to do your job well. Over so many years, literally working so hard, now I've penned down everything and make use of this. Learn, come, listen, go implement. I want y'all to do that. I'm here to support y'all. And if you feel that you need more training or guidance, do not hesitate to ask. Remember, me and my team are now, we are no longer in this to just do something, naam ke vaste. No, we are here committed to help each of you succeed in your role. And there's no shame in asking. I remember how many times I went knocking on everybody. What is MU? What is this? What is that? I didn't know so many things. And remember, when you ask and you get and you implement, it's a sign of strength. And it is a desire to improve. So I also want to remind you all that the skills and precision that you develop here are not just for this job. They're for your career and your entire future. By mastering these tasks, you'll build a foundation, beautiful foundation for growth, whether they're here or anywhere you go. You'll never forget all these things. So I want you all to collaborate, share your knowledge, and whatever you learn today, go and share with somebody. The moment you tell somebody, your knowledge increases because it will get retained. And we become stronger when we work together. And every one of us should excel. So I want each one, before I start this webinar, I want us all to make a commitment today to ourselves, to each other, that we will commit to our work with diligence. How many of y'all endorse this, that it's time that we understand that what we do is very powerful and it matters? And anything that you need, you just have to talk and the doors are open. So I want all of y'all in the chat box who really resonate with what I'm saying. You feel that today you have the power of doing something good for patients, the reason why you joined medicine. Please type out yes, 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 yes. And that is the motivation for all of us to go forward and continue our journey. Type out in there, I'm not continuing till I see the chats buzzing. Yes, absolutely. We should be proud of the profession that we have taken. It is not everybody who are in this capacity where we can help all the patients in the hospital. See, one doctor will help one patient, another doctor will help other patient, but we in the lab can help everybody. Remember the power that we have. And we can really, at the end of the night, we know we've done a good job. So with that, thank you everyone. And let's continue to strive for excellence in everything we do. Our job is to empower ourselves and empower the next generation. So the introduction to sample collection, what everyone needs to know, the crucial role of sample integrity. And I'm Dr. Shailaja, and today is August 20th. Importance, accurate medical diagnosis and effective patient care. Read this. Accurate medical diagnosis, effective patient care rely heavily on the quality of the collected sample. On the collected sample, the quality of the collected sample. I'm emphasizing the quality of the collected sample. From blood to urine to tissue samples, each specimen must be obtained using standardized protocols. What do I mean by standardized protocols? SOP. Some SOP, somebody written, not relevant to us. No, they are some standard guidelines. We have to draw the sample, blood sample in and collect. When you're collecting multiple samples, we have to follow the order of draw. That standardized protocol of order of draw is standardized protocol. And to ensure why we have to do it in that order. Why blood culture first? After that, what? After that, what? Because that will ensure sample integrity and reliability of test results. So this webinar will explore the critical step involved in proper sample collection, the role of all of us, all the healthcare providers, the consequences of not collecting properly, and by the end, all of us will have a comprehensive understanding of the best practices to uphold diagnostic accuracy and deliver highest level of patient-centric care. Now, what are the types of samples and patient preparation? Everybody, when we talk, they only talk about blood. No. We have urine, we have stool, we have saliva, we have tissue biopsies. And each type of it requires specific handling and collection protocols. And to maintain that integrity and prevent contamination prevent contamination. When I mean contamination, what is not there is introduced. What is there is lost. Either way, the integrity of the sample is lost. And what we have to start with is patient preparation. We have to understand, all of us have to go and put down our foot and say, patient preparation is crucial. If this patient is not prepared properly, please do not collect the sample. Ask them to come another day. Tell them, sir, your value will be wrong. Please come another day because we want to give your values correctly. And how do we ensure patient is prepared properly? We need to educate the doctors. Our youngsters, our interns and all, they have no clue. So we have to give them a list of what all samples need fasting. And when we mean fasting, we assume they all know it's 12 hours fasting. No. In India and many of the places, we eat 10 o'clock. And when we eat at 10 o'clock our dinner, at 7 o'clock they come to give our sample. Where is the question of 12 hours fasting? And then you find triglycerides are high, glucose is high, they land up with medication and the adjustments become a problem. So get down, tell them, write it down, give it to them. 12 hours fasting means previous evening by 7 o'clock, complete your dinner. Then come and give it at 7 o'clock. That is fasting. Proper patient preparation. If you're taking therapeutic drug levels, whether it is peak level or trough level, depending on the half-lives, half an hour before the tablet is taken. Now he says, madam, I'm taking the tablet at 8 o'clock in the evening. Come at 7:30 in the evening and give your sample. If you go to a theater and the theater, the movie is starting at 8 o'clock and can they go and say, please start it at 6 o'clock? No. So patient preparation, patient sample timing is very, very important. How many of y'all today felt, yes, it is very important? Go on, type out in the chat box. Today, what I'm saying is something that was not reflected before, that it can change the value. We took it for granted. Go ahead. We assume We always assume doctors know everything. They will tell that the 12 hours fasting. So we don't go ahead and we don't ask our thing. Absolutely. We don't ask the patients, are they 12 hours fasting? We assume that the patients are 12 hours fasting. No. Let's first thing first. Let us stop assuming that people know. Today, note down in your pen. Stop assuming that people know. If they know, it will be a reiteration for them. If they don't know, they've learned something and then they are following the right path. So, first and foremost, tip today is stop assuming that people know. Be it doctors, be it phlebotomists, be it anybody. Stop assuming that they know. Let them know this is the way the sample. Cortisol, only at 8 o'clock in the morning and only at 4 o'clock we have the biological reference intervals. If you take it, we don't have reference intervals. We don't know what to compare with. Urine midstream sample. If we do not give them instruction of how to collect, 100% it will be wrong. If the patient is menstruating, of course, and you've not taken the history, you've not told her, there will be RBC, and unnecessarily they will take it as UTI. So there's so many instances where patient should come prepared. Then aseptic techniques, especially blood culture. I have seen numerous amount of times. I mean, we have our skin microorganisms, then we use a toilet, we are in the hospital, we touch that, we touch this. And of course, on the patient's body, it will all be there. And if we do not use aseptic techniques, the blood culture grows something which is not in the patient's body. And we are going on assuming, where is this coming from? And imagine if he's on the ventilator, we think, okay, it's VAP, it's a central line, it's a corti, it's a catheter. No, actually, he didn't have anything. And if you see, the WBC count is not increased. So that is about adherence to protocol and ensuring that skin disinfection is mandatory. So who am I? Well, I am called Shailaja, and it's been 25 years in this laboratory operations, and I love teaching. I love teaching, and our goal today is to understand how to maintain sample integrity, which is vital in producing accurate lab results, and how it impacts patients' outcome. I hope all of you all have understood the key essence that I wanted to convey today is patient preparation, patient timing, sample integrity. And that is what we will be covering, and all the errors that can happen and the best practice to avoid errors and the strategies for implementing these practices in your lab. So let's get started. Why it matters? Because anything that is not done, it will alter. It will alter right from the time we collect the sample. And that affects the diagnostic accuracy and can lead to false or misleading results and misleading diagnosis. I'll just move this up, please. Yeah. Misleading diagnosis or inappropriate treatment. Now, imagine many people say hemolyzed sample. How many of you all have ever thought hemolyzed sample, CBC sample in a purple color tube, not knowing it's hemolyzed because we are not centrifuging it? How many of you all think that the hemoglobin content of it will be normal? When you run it through a 5-part or a 3-part or a 8-part, they calculate the cell size. Depending on the size of the cell, the machine will detect, okay, it is RBC, it is WBC, it is platelets. Now, if the cells are lysed and the number of cells are lysed, isn't that the RBC count is going to come down? Anybody have you all ever thought about it? That is the crucial part. In biochemistry, we think about hemolysis because we centrifuge it and we can see the lysis. But what happens in hematology? We don't get to see it. And those are the hidden things that will lead to wrong errors. Now, critical steps: patient preparation, sample collection, handling, labeling, transportation. At every level, only if we are correct, then everything will be correct. Otherwise, we are vulnerable to errors. And like I said, 65% of the errors occur at, and because of the errors, misdiagnosis harmful. So, improper patient preparation, incorrect collection techniques, transport issues, everything is a matter of concern. We have to address it. Now, types of errors. As I told you, what we don't see and what we see. Red blood cells, hemolysis, clot, microclots. The WBC is gone inside, the RBC is gone inside, the platelets are inside the microclot. Then what will you get the values? 100% it will be wrong. And that is when you have to look into the histogram in the system. So just one small mistake. You have a sample, they have not mixed it properly immediately. Microclot formation. If they've not mixed, means big clot, that you can make out. But what you can't make out is this small. That also by the histogram we can make out. Now, mislabeling, misidentification of samples, somebody else's value, somebody else's report to somebody else. Imagine we suddenly get a report that our creatinine is very, very high. Our urea is very, very high. And when do we realize that creatinine becomes high? When half our kidneys are already gone. What a shock it will be. All we know that our sample was labeled, somebody else's sample was labeled with our name. So first and foremost, what we do not, when the patient comes with the bill, we generate the label, stick it onto the Vacutainer and give that to the patient. And he goes there and they collect. We don't give the labels to the phlebotomist to stick on the tubes. At the registration counter, we stick the labels on the tube and give the tube to the patient. So that patient has his own tubes with his own value. Got it? These are steps to mitigate errors. Patient identification. Manjunath, Srinivas, David, 101 people, similar names in India also. So don't go by the name, go by name, go by hospital number. Always look whose bill is it? What is the name on the bill? Then collect the sample. Incorrect labeling, as I mentioned. Contamination, as I mentioned. Sample degradation. You take a sample after 45 minutes, 1 hour, 2 hours, 3 hours, you send it to the lab. Gone, glucose value is gone. It will deteriorate. More than 4 hours, CBC will deteriorate. All the cells will deteriorate. These are very, very common. And we think that, no, the person who's doing it is doing it properly. Until the clinician calls and something is wrong, they are not correlating. No. How do we stop it? We need to do random checks. But before we do random checks, we need to train our people properly. We have to train them in what are the containers. What right containers. The integrity of that sample depends on the container. And if it's a blood to anticoagulant, that is so important. What are the additives? I've seen people, EDTA tube they collect. Suddenly they forgot that they had to collect in a red color tube or yellow color tube. Take the EDTA sample, put it in the yellow and then our potassium comes very high. Where did the potassium come from? It came from the EDTA tube. So we need to understand that for certain tests, there is a certain vehicle to collect. Those are called containers or vacutainers. For sterile sample, we have sterile bottles. For unsterile, we have unsterile ones. We have swabs. We have blood culture bottles. And we need to use the right sample container also. We need to label it properly. We need to store it properly. We need to transport it properly. We have to, the chain of custody from one place to another place, when we have to give, we have to ensure that we are able to trace. Where did it start? Who came and gave it? When did they receive it in the lab? When was the sample processed? When was the result given? Sample was collected 7 o'clock in the morning. It came in the evening 4 o'clock. We have run it at 10 o'clock, reported at 12 o'clock. Only when we document, we will come to know, oh my God, it happened like that. And then when we come to know, we'll know we have to ensure we put a system into place in the chain of custody. So there's so many angles to sample collection. Sample integrity. Collection is one part. You have containers, you have labeling, you have transport, chain of custody. And if all this is not okay, you have consequences of misdiagnosis. 100% wrong report, 100% it is wrong. Plus, the patient, instead of getting better in 2 days, will take a longer time because he's not getting treated for the value which is inside his body. And then we have to repeat the test. Again, he has to pay for it. Legal liability is now coming in. But most important, if a patient comes to our hospital and he doesn't get the right treatment, he's not going to come back again. So it's very, very important. Forget about that. If we can't help, at least let us not do harm. Let us all learn to put systems into place and ensure we help the patient rather than harm the patient. So what is the role of we healthcare providers? Remember, all the phlebotomists, all the nurses, all the physicians, I'm reiterating here, and the laboratory staff, we are a team. And unless all of us know what is our role, what is our task, what is our responsibility, there is no way that we will do our job properly. So each one of them should have a role, task, responsibility document. What I should do, when I should do, how I should do. When that document comes to me, I know, okay, I'm supposed to do this. I'm supposed to do it like this, like this, like this. I'm supposed to do it at this point of time. When you give somebody that, don't you think it will be very easy for them to follow? So remember, for high quality samples, the phlebotomists need to be told. We are assuming the moment they have a degree, we are all assuming that they know their job. We are assuming that they know what to do. We are assuming that they know everything. No. We need to train. We need to teach. We need to learn how to train also. See, knowing something is one thing. Teaching people in a way that they understand is a totally different thing. A good teacher makes complicated things easy, and a bad teacher makes simple things complicated. How many of you all resonate with this idea? If he's a very good teacher, in our student days, maths teacher, oh, so good, they really, we could understand. And there were some teachers who, how much ever they told us, it just didn't get into our brain. So knowing is something, able to communicate and let the other person know what you know so that they understand, they do it, and they are able to teach somebody again who will do it correctly. Then you say that you know the subject. By hearing about it, we cannot say we know it. When we know, we implement, then we teach somebody and they implement and they teach somebody and that other person also implements correctly, then the cycle gets completed. So remember, do not assume that people know. Start learning, start teaching, start training, watch what you taught, whether they are able to do it exactly the way you wanted it to be done, not how they perceived it has to be done. Then, once they master it, ask them to teach their juniors. And once they are able to teach and they are able to get a good job done, then your role is to step back. You have a robust system in place. Then that cycle will continue. Others, every time you have to do the teaching. Okay, nurses and physicians, we have to tell them, I will not accept a sample. Only at 8 o'clock, only at 4 o'clock cortisol. I want fasting, it's 12 hours. And if suppose we see that patients are not fasted, we take an undertaking that it is emergency. Otherwise, we tell the patients, please come back. The values are not going to be right. And all the lab staff they need to verify sample integrity. Processing the specimens, reporting are based on the quality of the original sample. When I mean original, it means the moment the sample was taken in the patient's body to when you are actually putting it into the machines or you're doing the testing, till that time, the entire sample is exactly how we took it from the patient. How many of you all feel that the samples that we are collecting today, when we are analyzing, is 100% the same when we start analyzing? I want you all to start putting in the chat box. I want to see how many of you all feel 100% it is correct, and how many of you all feel no, it is not correct. If you feel no, type in N. If you feel yes, then type in yes. Why? All of you all start, please. I want you all to start. Absolutely, there's no harm in saying that. We all were in the same boat. Exactly. There is nothing wrong in accepting that we need to put systems into place. Only when we accept that we need to put systems into place can we help patients. If we are in the thing is, no, everything is okay, we are under false, we are harming patients. So today, let us understand that these were not taught to us. We need to now concentrate on this area. We need to learn how to put systems in this area. And we need to make all this ends into whys. Absolutely. The first step is we acknowledging, yes, there is a gap. And once we acknowledge, then we should learn how to plug that gap. And to learn how to plug the gap, we should learn how to do it correctly and then train our staff to do it correctly. Thank you all of you all who have said, no, we know that is the truth. So let's start acknowledging the fact that there are no systems, and not only in India, all of the world. That's why only 40% of the labs around the world are accredited. It is not only unique to India, because this is not taught in our curriculum. They teach us as medicine, as palpation, percussion, everything. But where did they teach us about all this? With equipment coming in, vacuum coming in, all the sample collection, we were not taught all these things. So there's no harm in saying, no, okay, now we acknowledge it. Let's start working towards it. So what do we do now? Standardized sample collection protocols. Everything should be standardized. Right from patient sample item, foundation, labeling, strict. Every label is matched to the individual. Where the site of collection, accessibility, patient comfort, contamination, the technique that we use, the angle, the depth in which the needle is inserted. It makes a difference. If it is right on top, you won't be able to get the blood. If it just below just enter the blood vessel, then you're taking a lot of force and hemolysis. If it's in the center, then free flow. Then where is the tip of the needle? And where is the opening? Is it up or down? Then have you pierced through the second layer and gone down? Is there hemolysis? Is there hematoma? So there's so many things that we should put systems into place. So everybody talks about, and everybody thinks quality control is only a QC in the lab. No. Quality of the specimen, controlling that specimen integrity is not lost, is quality control in pre-analytical phase. For how many people this is a bulb-on mome? Type BO. Everybody, we all knew QC as only QC. No. Quality control is controlling and ensuring quality all across pre-analytical phase. Only then we will get correct values. And we have to ensure that all the risks are mitigated. Every step, wherever there is a risk, if something is not happening properly, doctor is not giving instructions properly, go tell him, sir, this is the instruction you have to give. Don't wait till he gives wrong. Sir, these are the instructions, special instruction. Other random sample, no instruction. But these are the tests where special instructions are there. Call all of them for a meeting. Tell them what it is. Or put up in the system. Patient should be prepared. Is the patient prepared? Yes. Click. Yes. Putting systems into place to minimize this, there's a strategy. And that is a strategy which we have to learn. How the protocols to be put, what protocols to be put, so that there is minimized variability and errors. Then comprehensive training, 1 hour training, 2 hour training. You will only have an overview about, okay, this is how problems happen. This is how errors happen. But how do you go and ensure that it doesn't happen? For that, you need to have comprehensive training. Wherein, like say, for example, I'll tell you, you're putting barcode. Okay, you need to put the barcode of the patient. Now, what I will do, in my mind, putting barcode on the tube is what I have to be told. One person will go and put the barcode straight. One person will put it angle. One person will wrap it around the tube. One person will put it on the cap. He's putting the barcode. But if he's done it like that, how are we going to scan the barcode? So in order to teach them, we don't have to just tell them, put the barcode. We need to teach them, you need to put the barcode straight. And the reason why you need to put the barcode straight is because only then we can scan it and we can get the number. Now, if you put it across like this, the scanner will not take. If you round it, the scanner will not take. If you put it on the tube on top, it will not take. Unless you tell them. When you do something like that, the work is not done, then they will stop doing it. How many of you all feel that we do not concentrate on telling them? We tell them you do it like this, but we don't tell them, if you don't do it like this, we do it and you do a mistake, and the types of mistake that can happen, and make them aware of the different types of mistakes. They are more aware of not doing mistakes. I want all of you all to type out now. All of you all type yes. If we tell them that we explain to them, if you do it like this, then the work which you're doing is going to be wrong. How many of you all feel they will start doing it correctly? How many of you all feel they will start doing it correctly? If you feel yes, we now need to change our system of teaching by not just telling them the right way of doing. We also have to tell them the wrong way. If we do not do it properly, then it is not correct. Absolutely. So we need to change the way in which we teach people, train people. Gone are the days we tell them, do this, do this, do this. Now we have to tell them, if you do this, It is correct. But how do you do it is also important. What are the mistakes you should not do when you're doing this? Concentrate on the mistakes. Then they will avoid doing this mistake. That is how errors will stop. And use automation technology. When you use automation, all the errors are mitigated. I mean, I won't say all the errors, most of it can be mitigated. Now, how many of you all till now have understood how you have to approach sample integrity? I know many of you all would have come thinking that I'm going to teach you all where to put the tourniquet, how to use a tube, what it is. No. That everywhere people are, yes, it is important. We will tell. But you all have to learn where things go wrong, what you have to do, when you have to do. For how many of you all today, it was a totally different angle in which you are looking at pre-analytical phase. Please type out me, if it was you. I don't want this to be one-side lecture. I want all of y'all to start interacting if you really resonate with what I'm saying. Absolutely. That is what we have to learn. That is what we have to start tuning our brain to start thinking in this direction. All of us, we know. It's only channeling it in that direction. Now, tomorrow when you go back to work, start implementing. Please note down. Please, all of you all note down these points. Whatever I'm saying. Of course, the recording will be there. You can go back and see the recording, but note down these points. These are very important. And when you go back and you go teach them, you show them how they're doing. Stand over there, see how they're doing. And after that, when you think, okay, now they're good, you again have to surprisingly go and check again. Because when the cop is there on the road, we will be extra cautious. And if nobody is there, but what we have to inculcate into our staff, whether people are watching or not watching, integrity should always be there. Inculcate into them the importance of their job. Give them that respect. If they don't do, even if they're just collecting a sample, when we give them an importance that you're doing such a, and this is the most important work, please do it correctly. Everybody plays an important role, not only the person in the handling the equipment. I would give credit. The most important person in a lab is the sample collection person. Then start noting down, document all the timings, then see whether everything is happening at that particular way in the particular time and at the place where it is supposed to. And once we map and we see some gaps, then we go on improving the system. And then what happens? There will be continuous improvement. It is continuous. Some new person will come, somebody will do a mistake and we catch it, and we do not reprimand. We don't shout at them. All of us are humans. We do mistakes. No, don't do this. Because of this patient, now the value became wrong. And now because the value became wrong, he was not given the right treatment, as a result of which the patient suffered. Give them the entire scenario. Next time, they will never, ever make a mistake. And that is how you empower them with the right knowledge of the consequences of not doing a good job. The other point, please make people aware of the consequences of not doing a good job, because it is harming patients, not helping patients. So, all the quality indicators, turnaround time, monitoring the time from sample collection to analysis, timely processing, ensuring no hemolysis, clotting. Even if you're taking a swab, whether they have put it on the slide properly, whether they have dried it properly, have they sprayed it properly, Whether they've gone for FNAC, have they aspirated properly? Have they aspirated the material properly, or there's no material over there which is aspirated? When they're taking a swab, have they collected the swab properly? All this matters. Then you evaluate, track, and then you see how many times one error is happening and where it is happening. And if you find that one particular time when one particular person is there, it's happening, then we know that that person needs to be trained. Then we intervene and there is scope for improvement. So, how do we have the best practices? Training, training, training. Training is not just awareness. We get into it. We dissect the whole thing. At every step, we tell people what they have to do, how they have to do. Like starting from the MRD. Give a slip. Why patient age should be captured properly. Tell them the reason why you can't make a mistake over there. Because if the age is different, the biological reference intervals are tailored to that age. Now, instead of putting 47, you put 77. All the ranges are going to be different. Tell them the importance of those age. Tell them the importance of sex. Male is different, female is different. Tell them the importance of a value of an email, the value of a phone number, because tomorrow if we want to communicate, we need that. So give them a list and take it in writing that yes, we have understood why these things are to be captured and why it is mandatory, it should be correct. So continuously, new people will keep coming, old people will go, new people will come. So every time you can't go on training. So if you put a system where I'll tell you what we do in our lab. I teach one person. He teaches his junior. His junior learns, does, and then he teaches his junior. And that junior done. Till then, my job is not done. Once that happens, this cycle continues. My junior teaches his junior, junior teaches that junior. And that continues. What used to be a training of the laboratory process used to take 3 years for some technician to understand. Then it came down to 2 years. Then it came down to only. Now it's come to 4 months. That fast people are grasping because the systems have been refined and they're just able to get on and learn. So that is how continuous education, quality monitoring. We need to regularly, suddenly we should go. We should see how they are doing and see if any gaps are there. And they shouldn't be scared about it. And then all of us should sit. Okay, how do we handle this? Let us call all multidisciplinary approach, lab staff, teams, call them. Okay, now this is an issue. Now you all suggest how we can go about it. Get them to answer. They'll come up with wonderful ideas because they are at the ground level. Collaborative approach. So the best practices for sample collection is standardize all the protocols, regularly train and assess your staff, keep their skills sharp, ensure that we communicate to the patient about what is their role, how they have to be prepared, how they have to come fasting, what activities they are not supposed to. FPS, PPBS. PPBS to collect, they will drink and they'll go around the entire hospital and come after 2 hours. Of course, the PPBS value will be low. So communicating to the patient is very, very important. So before and after precautions. There's a lot more. It's already 9 o'clock and I think I'll stop here. But before that, I want to show you all how much is there in just sample collection. Can you see this? Before and after precautions for blood, urine, what you do for stool specimens, for everything, and then how the samples have to be collected. Then we go into what time, why you have to do it that time, what you should not do, which tube, what is the reason, what does this tube contain, Why? Can you see this? What does this tube contain? Why should it be? What is the difference between plasma and serum? And then we go on of the different tubes, then the different how a lab phlebotomy room should be thinking. What are the essential items that has to be kept? Which is the vein? Which is the gauge of the needle that has to be used? How they have to how the holder should be kept. Can you see every single thing? Which is the vein? How do they palpate? How do they mix? Can you all see all these things? If a baby, where they have to take, if it is, I was telling you about the angle. Look at this, what will happen. Show them with pictures, show them with pictures where a tourniquet has to be tied, which position it has to be tied, how much inch above it has to be tied, and how you dispose it off. Can you see all these things? How the label has to be put? How do you sanitize? How do you take a sample, biopsy sample? How do you take a fluid sample? How do you transport it? These are all areas which we have to. How much of volume the vacuum is there in the tube? How much they have to? Is it correct? Are they collecting like this? No. Yellow tube is okay, but EDTA tube, anticoagulant to blood ratio is lost. So all these things have to be. How do they centrifuge? What all they have to do? What is the instruction sample collection instructions? What is the DOS instructions? How do you what is a 24-hour collection? That many of us know, and we think, because there's certain things. Can you see? These all are pictures. Why I'm showing you all pictures is when we show them as pictures, put it as pictures, then they will understand and they will be able to do a good job when we show them like this. So that is how our training should happen. Everywhere. It goes on and on and on and on, the heel, the way they prick. So like this, when we teach every bit of it, that is when we know that we have done a good job. And remember one thing I always tell, call the lab if there is any problem. The stupid question is the one that you don't ask, but call. So what I'm trying to let everybody know is, okay, just I'll give you an example now, even though it's 8 o'clock, I don't want to go beyond the time. List before collection. Let's say blood specimen. Before collection, verify patient ID to identify name, date of birth. Then check the test results. Keep all the tubes ready for those tests. Not like, oh, let me take two. Then suddenly they'll say, HbA1c, purple color is required. No. Check what all tubes you need. Keep it. Check whether the patient is fasted for that particular test. All needle, tourniquet, alcohol, gauze, everything. Explain the procedure. Then ask if any bleeding disorders are there. Wash your hands and put the gloves. Like this, we have to put systems over there. Then apply tourniquet, cleanse with alcohol, insert needle correctly. 15 degrees, 30 degrees angle, correct order of draw. Fill the tubes to correct volume. Gently invert the tubes. Number of inversion depending on the time. Release the tourniquet before removing needle. Apply pressure. After collection, label the tubes immediately. Date, time, collector insulin, dispose the sharps, check the puncture site, process the samples within the time frame, store at appropriate temperature, document. Now, if we tell all these to the technicians, we train them, this is what you have to do, this is how you have to do, show them pictures. Now you will tell me, will that person do a good job or not? Type out in the chat. I want to see. How many of y'all feel this is how we need to train our staff? Absolutely. Now, all this training material is all available. I have already, for the last 3 years, I have recorded everything. 450 videos I have recorded with only this information. So you all don't have to go searching anywhere. Please, everything is available. Just enroll, go on. Forget about the price which is there on the website. For all of you all who really want to learn, want to put in the thing. Next webinar, I will tell you all, we are going to start sample collection workshop next in September. And whoever you all feel, because I can't take how much ever I want to take in 1 hour, I can't complete it. We need to do it systematically. Continuous every single day, 8:30 to 10:30. We will go on for 1 week or 2 weeks till we complete the entire, till you all are sure the entire pre-analytical phase. You have the material to teach, you know what to teach, you know what to implement and how to implement. That is my goal. And since I can't do it in this 1 hour webinars, I have decided, before I didn't have workshop, I just had recorded videos. Then I realized, my staff said, no, ma'am, we have to have workshops. And we decided we will have workshops Wednesday, Thursday, Friday, Saturday, 4 days. And then if we have not completed, we'll go on to next week. One workshop every month. We take sample collection and we complete that workshop. Then next we'll go on to quality control. So this is the method in which I realized that's the only way that we can go systematically. We can learn, implement, teach, and put systems into place. How many of you all resonate with this? Please type out yes, 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 yes. How many of you all resonate with this? I want all of you all to type out yes, yes, yes. Don't go into analytical. Because this is the way, the only way that we can empower ourselves. Every single day we are learning. And everything is there. How simple today? How many of you all felt it was easy to understand? Now, each of you all type down, was this something that you could understand? Was there something that you didn't understand? Please put it, I'll address it. Now I'll take the question and answers. You all can unmute yourself. You all can unmute yourself. Okay, 1 second. I think I have to unmute all of you all. I'll give you all 1 second. Oh. Yeah. Please go ahead and unmute yourself. And whatever questions. How many of you all felt you understood the core concept today? Yes, Mary. Aparna. Thank you. Is there some area where you all didn't understand? Please go ahead and type out or unmute and so the concept of how to do, when to do, what to do, that is very, very important. Now I want you all to, any questions? I'm here to take any questions. Any of you all can unmute yourself?
Ma'am, I have a question, Rashika this side.
Yes, Rashika, please go ahead.
Yeah, to calculate the TAT, usually we mentioned as a sample received or a sample collection time to reported time, basically.
Yes.
So specific question is like certain times, like, the sample collection, the phlebotomist collects the sample at 9 o'clock.
Yeah.
But the sample reaches to the central laboratory at around 11 o'clock. Okay.
Yes.
That's a point one. And the second point is like, they authorize the sample probably around 4 o'clock, 4 p.m. And they print the report around 7 o'clock.
Yeah.
Okay. Sample collected at 9, reach it to the lab, central laboratory at 11.
Yes.
Authorized at 4 o'clock. Printed at 7 o'clock. In this case, what is the TAT? I mean, how can we, like, what is the actual TAT? What we have to mention on the report as per the NABL?
Yes. So that TAT is totally out. The sample integrity is out. So actually TAT is from the time the doctor orders a test to the time the doctor gets a value for the decision to be made on what is the treatment. The typical TAT.
Oh.
That is a TAT from the time, because once the doctor says, I want sodium, I want potassium, because I want to treat the patient now because I feel his sodium is low. Now he orders a test. They go for billing. After 2 hours, the billing comes. Then the sister will, after 2 hours, he'll collect the sample. Then after that, the sample is collected. What is the sodium value in the patient's body? And when is he getting treatment? So when you say emergency samples, they said 1 hour TAT. Why are they mentioning 1 hour TAT for emergency samples? But for the regular samples, 12 hours also is okay. That is where we need to put systems into place, so that wherever, if the billing is going for a longer time, make sure that the billing happens immediately. If the sample is not being collected immediately, make sure you put systems that the sample is collected. The sample is not transported. Why it is not transported? Why is the delay in transporting? What happens? At one point of time, we had where attenders are, the attender is not there, so sample collected and kept. 4 hours. So we need to address this, and we have to cut it down. And then once it comes, received. So these are the gaps. Exactly what you said, Rajshekhar. I'll come to your point also.
Yes.
So then, if we don't address the gap, your TAT is right from the time labs, what they do, from the time the sample is collected to the time the report is given. That's a second TAT. You got what I'm saying?
Yes, got it.
So sample collected to report given is the TAT, which is a lab. But if you really ideally want to go and help the patient, it should be from when the doctor ordered the test to when he got the value for treatment.
Understood, ma'am. But as per NABL, I mean, it's a question like just to understand technically.
Yeah.
As per NABL, what is supposed to be mentioned on the report? Sample received time, or a collection time, or a billing time?
Collection
and
time.
Authorized time, or a report printed time? What has to be
authorized also, it's okay. Printed report, it doesn't matter. But okay. Authorized and released.
Right.
Authorized and released so that the doctors can see.
Okay. And what about the collection time?
Sometimes what happens, patients will come. They'll come after 2 days and they'll take a printout.
That's fine, ma'am. Authorized, I understood. But what about the collection time? Like, there is a billing time and sample collection time, sample received time. What is supposed to be mentioned on the report actually as per NABL?
It is the sample collection time.
Collection time, not the received time.
No. Sample collection time, sample received time also. Both should be there.
Both should be. Collection time and received time should be mentioned in the report.
Sample collection time, sample billing time, sample collection time, sample received time, sample preliminary report release time, final report release time. This is the.
Hello, madam.
Yes, sir.
Madam, my question is, how much time after the sample collection should we proceed for centrifugation of that sample?
Sir, 20 minutes, sir.
Yes, madam. Thank you, madam.
Yeah, by that time, if you have vaginous which have clot activators. If there's no activators, then we wait for half an hour. Because small fibrin clots will be there. So we wait for half an hour. And one more point, good point that you brought up, sir. If they're sending it through the chute system, the moment the sample is collected, please ask them not to send it in the chute system. Wait in the emergency department for 20 minutes, then send it in the chute, because if you collect it and send, because of the pressure, it gets hemolyzed.
Okay.
So if anybody is having chute system, do not ask the emergency department to send the sample immediately. Let them keep it for 20 minutes and then send it, because by the time it will get clotted and then the hemolysis will not happen.
Okay. Madam, after collecting blood sample for the blood sugar estimation, after how much time we should proceed for centrifugation if we are collecting for blood sugar estimation?
Sir, blood sugar estimation to be colored in the gray color tube only.
Yes.
So once you collect in the gray color tube, it will not deteriorate. But if you collect in a red color tube or a yellow color tube, every hour 25 milligrams will reduce.
Yes, yes, yes.
Every hour 25 milligrams will reduce. So never ever collect. Even if we collect in a yellow tube and you think, okay, in 2 hours it's going to analyze. In 2 hours, 50 milligrams is gone.
Yes, madam. Yes.
So always collect in gray color tube.
Yes. So when we collect in plain vial or red top vial, after 20 minutes we must do centrifugation.
Yes,
That
yes,
is it.
yes. And centrifuge and separate the serum.
Yes, madam. Serum should be
If
separated.
you don't separate the serum and if it is still in the cells, then of course the
Yeah.
values will still, because the cells will start using up the glucose.
Okay. Okay.
Unless you have a serum separator and the gel separator and you separate, or you take it into another tube and you separate it.
Okay, madam. Thank you.
Any other questions? Okay, then. Thank you all so much for coming in. The next topic, this is all about sample collection. Let me think about another topic that I will, which will help you all. If anybody has any suggestions of what topic you want me to take next, please type it out in the chat box. I will take that topic only. I thought now I will start asking you all only to give me the topics. Anybody? Anybody would wish to suggest some topics that you would want me to take? Okay, then I'll go ahead with my schedule of topics. Critical values. Okay, Suresh. Right.
Ma'am,
Okay, how to read EQUAS. Yes, that's in the QC module. Numbering of samples. Okay. Troubleshooting of IQC. Yeah, that's all there in the QC QC module. When I take up QC, I will tell you critical alert. Okay. Right. QC interpretation. Yes. Our QC module is so sometimes when I go through it, I myself feel, my God, how did I ever do put all that? I'm in love with my QC module. There's a lot that you will it's an eye opener. You'll love it. Yeah. All these are already covered in the modules. Then we'll wind up for today.